we start with the first chat today, fireside chat, and as AI transitions from pilots to population level deployment, especially when we talk about healthcare, the real challenge lies not just in building intelligent systems, but ensuring that they are working in harmony with the clinicians, with the patients, with public health ecosystems across diverse geographies. And our next speaker leads this effort across emerging and global markets, overseeing the operationalization of AI-driven healthcare solutions. His work focuses on translating deep tech innovation into outcomes that are clinically relevant, culturally adaptable, and scalable in real-world health systems. So please join me in welcoming Mr. Vicky Nanda, COO and Head of International Business at Niramai Health Analytics, as he packs the AI's role in India's health stack. He's in conversation with our editor for Business Republic Digital, Mr. Pranav Kulkarni.
To begin with, for all of us, just to understand, Niramai is in fact one of the, I was just going through the profile and I just learned that it's one of the World Economic Forum's top 20 technology pioneers of 2024. So that's a company that's working in healthcare using AI for early cancer detection. Vicky, I just want to get started and understand from you, how did this journey actually begin?
First of all, thank you. Niramai, I would like to just quickly touch upon Niramai. So the expansion is like non-invasive risk assessment by machine and artificial intelligence. Actually, the journey began with the founder, Dr. Geeta Manjunath. She's a computer scientist, PhD in AI. She was a lab director at Xerox. She has worked earlier with HP, handling teams of data science, building AI models for healthcare. Now, back then in 2013, she suffered a setback by losing one of her sister-in-law due to breast cancer. Now, that changed everything for her because she saw there were like 2 young kids, and sister-in-law was like just under 40. So she was completely shattered. By the time she was recovering from this incident, there was another incident on the husband's side, again, a young death due to breast cancer. So she quit her job and took this as a research project, Niramai. And she never thought that this could be a potential opportunity back then, right? So here we are, Niramai. Today, we are an AI medical device company. We are a ISO 13485, ISO 27001 certified. Quality management systems are established. We are also GDPR compliant. In India, DPDP Act, which is for data privacy, we are compliant with that act as well. It is CDSO registered as well as made in India, which is an important part. So that's Niramai for you.
Okay. Vicky, one of the challenges, so to say, while AI on one side facilitates early healthcare or early diagnosis, trust could be one of the issues in terms of depending on AI systems for your own health. Is that a challenge? How did you overcome that? What were some of the initial issues or challenges that you faced while working on this concept?
I think this is a very important point because whenever in our life we become sick, we go to a doctor, we trust a doctor. Now we are saying trust a machine. Okay. So we need to understand, certain things here, how the machines are built, and also how the doctors are trained. Now, doctors are also trained on certain academic pathway when they look at images, when they look at tests, and then they use their training to talk about the clinical outcomes. So same way, the machines are built on a trained model so that you can trust the machines. But before you start trusting the machines, clinicians will expect, some kind of validation on those machine learning programs. Now, these validation becomes the starting point for clinicians to trust, because ultimately clinicians are going to use it. Because AI with doctor is the perfect, intelligence. No one can be standalone. The kind of innovation is happening today. So what are these validations? These validations are basically primarily if you are able to prove the accuracy of the test, the new innovative test with some of the existing technologies. For example, in our case, we have built an AI medical device for breast cancer detection. Now, the traditional technologies are mammograms, ultrasound, and confirmation biopsy, right? So we have to go through a rigorous kind of testing and validation to be done across these three technologies before you can actually say, publish a report in a scientific journal to tell the doctor that here are the sensitivities and specificity of a new device which is actually performing at par and at certain areas better than traditional technologies.
Okay.
So those validations gives confidence, Pranab.
But then what's the difference between conventional technologies and AI-driven technology? And could you talk, if you could give us an example of where you've actually implemented it?
Traditional technologies like mammograms are X-ray based technologies. And then there are certain costs which is given that these technologies carry. Now, innovative technologies obviously look for opportunities where there are certain gaps. For example, can traditional technologies do screenings for women at a younger age group? Can we address this market? Now, can we make it more cost effective? Can it be a tool where it can be used by every woman on the earth? So those are the fundamentals we keep in mind when we are developing these technologies. Now, just to highlight a little bit more, Niramai technology is basically a non-radiation based technology. It's a thermal based technology. In our technology, what happens is that we are not looking at analyzing the images. When you are looking at cancer detection, you are looking at images, you are looking at analyzing those images, interpreting those images, and then providing clinical outcomes to the doctor so that next line of treatment or next line of testing can be decided by the clinician. Now, what AI can do is actually can do it faster, can do it with less error, and can actually support the doctor by focusing on high-risk patients. So these are, some of the fundamentals AI can bring in and our technologies can bring in to make early detection possible.
Okay.
Yeah.
You were mentioning you carried out tests on about 15,000 women. Can you just tell us what exactly was that project about?
Yeah, so it's very important, like companies like us, like we are just pioneers in this AI, very early ones to bring the AI in the real world. Now, what does that mean? It means taking the AI where it matters the most. Like we have urban areas where we have like doctors available, machines available, access is there, quality healthcare is available. Okay, but what if we go to a district level and go to, let's say, at taluka level and at a village level? Now, when we have to go really at the rural level, primary level, this is where AI can play a role. And I would like to share that experience where we have actually implemented this AI at primary level, screened about 15,000 women with just one device over a period of 12 months across 89 locations in 323 facilities. 15,000 women were touched, screened, tested. 450 were found screening positive, out of which 50% went for radiological diagnosis. 27 cancers were treated. It's a perfect example how AI can actually be implemented on ground in rural areas where there is no doctor. So AI can actually play a role of triaging, identifying the high suspect cases, and then bring that suspect cases through healthcare programs to the district hospital for diagnosis and treatment.
Okay. How does a common man access it? I mean, for example, if I want to, go to a laboratory and get this conducted right now on my family members, for instance, what is the penetration like? Where is this test available? Do we have that kind of availability of this particular technology near all of us, wherever we are?
Correct. I think it's a very important question, how these new technologies are coming, both in private and, let's say, rural setting. I think as far as rural is concerned, definitely we need a government push so that they can adopt these AI technologies and make it available for every woman. so that it should not be a question for a woman to travel to big cities, big hospitals. But when it comes to private, I think it is also important that clinicians look at these validation studies. Today, we are present in 200 plus hospitals across South, West, and North. Now, these are important, but is that a number that I'm looking at? No, probably would like to be there in 10,000 plus hospitals, or maybe in all the hospitals, because that's the scope of the technology. It can be cost effective even for a diagnostic center to afford this. So that is where we would like to aim for, to be available at all the places so that women can access it in the neighborhood.
Okay. Vicky, one of the challenges in healthcare sector is the cost, one. And second, acceptance of these technologies by insurance companies. Because whenever an individual, a common man goes to a hospital, what he or she is bothered about is the cost, and insurance companies need to accept these technologies or these results or tests as valid. What is the response that you've got from insurance companies on AI for preventive healthcare?
So I think it is a very important question, because when it comes to AI, one side is patient, then there is clinician, and then there are hospital administration and claims. It has to be integrated, right? So it is very important. Now, as far as cost is concerned, cost is, let me talk about Niramai. Our innovation has brought down the cost to 1/10 of what a traditional technology may cost for a deployment. Now, that is one side of it. So the cost is 1/10, but the accuracy is also higher than 30%.
Okay.
So you look at the overall impact innovation can bring. And second part is on, how insurance can accept this. So clinicians play a very important role, because they will look at these validation studies and try to include this into their daily testing. However, today, insurance and clinicians today are seeing this as a wellness, preventive screening point of view, so that they can actually provide, support from insurance side to claim these tests from insurance company as a reimbursement. So a lot of employee wellness programs are sponsored by insurance companies. A lot of these preventives are reimbursed by the insurance companies. Definitely, I would like this to grow from here to hospitals, where diagnostic screenings can also be reimbursed by insurance company. That's the aim. That is something we would like to aim as a new innovative technology.
Okay. Going forward over the next 5 years, if I really have to ask you about acceptance of AI in healthcare for trusting, for detection of illness or serious diseases, so to say, what do you think next 5 years look like?
It's a very important question. I don't know whether I will be able to answer that question, but yeah, I will try to attempt
in terms
that.
of need as well as probably from acceptance.
Yeah, sure. I was talking to one gentleman here. So AI is actually, if you look at AI, we need to look at AI along with the doctor, as I said initially also. And when it comes to AI at rural areas, maybe AI can play a role, as a standalone. But together, it can play a very, big role. One, for the faster detection purposes. So I see a role of an AI coming into the system, not as a standalone player, but as an integrated intelligence layer for all the stakeholders, so that every woman today can access this test. That is the aim. If that can happen in fast track in next 5 years, I think that is awesome. Be it any technology, I'm not specifically talking about breast cancer detection, maybe other technologies which are also looking at some of these, public issues, health issues, whether it is TB, whether it is, others. But definitely when it comes to cancer, oral, breast, and cervical are the main cancers which government also focuses upon, and they are building on AI mission around these cancers. Mm-hmm. So it is very important that these technologies should be made available in the neighborhood. Next 5 years are important, definitely, Pranab.
Okay. Do you think doctors as well as laboratories have accepted the technology? What have you faced any challenges in terms of convincing people or convincing laboratories or doctors to accept this as the new form of detection?
Correct. I think if we look at the macro numbers here, that is very important because today, just on the breast cancer detection subject perspective, we have only 1% women in India taking test. Only 1% women. Now, what is the outcome of that? The outcome today is 96% of the women reaches tertiary care in late stages, which is stage 3 and 4, leading to late detection. Now, this late detection has huge impact. One is, of course, on the quality of life, mortality, and then, there is a economic loss of life years. So all these impact not only to the family, but also to the governments. So it is important that, we focus on these technologies, bring that into care, and tell the clinicians that the use of the technology is for initial assessment, especially in primary screenings, before they develop the confidence to move into the diagnostic screenings. AI on radiology, we are hearing about it, but some of the primary screenings that we are focusing on, I think it should be allowed, it should be grown, so that more and more people participate in primary screening so that early detection can be made possible.
That brings me to the very theme of this summit, and that's we are looking at India's AI leap. I mean, cracking the India code. When we look at India as a global player, where are we placed in terms of AI for early detection against global competitors, against the West, for example?
I think there is a lot of growing demand for such innovative technologies. We ourselves are seeing this demand, Pranab. We started our international business a couple of years back. Very proud and happy to say that we are present now providing this technology in 20 plus countries, actually. And again, we are seeing demand coming in from most of other regions. I'm specifically talking about all the regions, right from Asia to Middle East to African region, as well as Latin America, US, Europe. There are different challenges in each of these countries. If we can divide this into developed countries and developing countries, you see, developed countries have different problems when it comes to screening programs, and developing nations have other problems very similar to India. That participation is very low, just very similar, like 1%, 2% women taking up the test in low and middle income countries, whereas in developed countries, 60 to 70% women takes test. But there, the problems are different. The challenges are different. Now, challenges could be with respect to technical challenges when it comes to, with respect to devices, with respect to crowd management, with respect to opting out of the screening programs because they don't like specific test. For example, in mammograms, I was reading one of the article in one of the West that women said, I don't want to continue with preventive screening with mammogram because it is not comfortable. It's radiation-based, right? Whereas in our test, it is completely non-invasive, no touch, no see, no radiation. So there are different use cases which are developing in different, parts of the world in terms of, a growing demand for our products. And again, made in India.
Wonderful. Vicky, thank you very much. It's a pioneering technology, and I wish you all the best for this made in India product that you are, in fact, and the most important fact is the critical need in the sector that you're catering to. Thank you very much for joining us.
Thank you so much, Pranav. Thank you.